Biomarker testing is big for our patient community. If we could get everyone tested, and then we could take a look at the appropriate treatments for whatever comes up in their testing, that gives the patient so much power.
Welcome to For the Health of It. I'm your host, Bill Evans. In this series from Komodo, we bring together some of the world's top health experts and industry luminaries to discuss some of the biggest challenges and trends in healthcare today. We're excited to be joined by Stacie Lindsey, president and founder of the Cholangiocarcinoma Foundation, to talk about how data and technology can help enable earlier diagnoses and better treatments for this rare and difficult to diagnose cancer. Like most complicated diseases, I would imagine that care coordination is also a very difficult undertaking for these patients. Can you talk a little bit about how digital is transforming that for this patient population in a way that may make it easier for them to access some of the services they need to get the help they require?
I hope that post-COVID, that some of the things that we have learned will stay in place, and I think telemedicine is one of them. Cholangiocarcinoma is most often seen in patients 65 or above. These are people who want to be seen in where they live, and there often are not specialists in a lot of these areas.
So what do you think the expanded role of data and technology is beyond the clinical trial?
I think the opportunities with data are extensive. As we grow together and expand these relationships, I think we're going to find that there are many, many opportunities that we haven't even explored yet.
So for other foundation heads like yourself, what would you suggest is the way to bridge that divide?
Well, one of the things that we've talked about is doing kind of like a brain trust or a working group of foundations with Komodo and with other data companies. Each foundation can't have someone who understands data and understands medical writing and understands advocacy.
What is the one thing you're most bullish on that you think is happening now or happening today that is going to have the longest term impact in terms of changing the experience for these patients?
I think biomarker testing is big for our patient community. If we could get everyone tested, and then we could take a look at the appropriate treatments for whatever comes up in their testing, that gives the patient so much power. And I think oftentimes, many times, patients are not getting this testing and they're not getting the testing early. And so then, they don't even know that they have any options.
So what can our viewers do? How can they support your foundation or this patient population or nonprofits like yourselves in disease areas that may be closer to home for the particular individual?
There are many things that people can do to support specific disease states, especially ones that affect their friends and family. It's really important to connect the patient not only with a specialist in the disease, but also with advocacy groups. Advocacy groups support the patients emotionally. They can help with financial support. They can help with educational support. There's caregiver support. There are all kinds of things that we can help with that your medical professional may not help you with.
Be sure to follow us on social media, including LinkedIn and Twitter, for news and updates about future episodes. This has been For the Health of It. See you next time.